94.1 WHRP, today's best variety of R&B. Tony in the morning and DJ Primetime 256. It is time for Wellness Wednesday with Dr. Whitney West. Good morning, doctor.
Good morning. Happy hump day.
Happy hump day and bringing some wonderful health tips for us. And today we're going to talk about the routine screening for women and how I guess we need to just start getting these things on schedule. Tell us about that.
Yes, so a lot of people ask if teenagers should see when should they see a gynecologist? And what I usually tell them is if the pediatrician can't take care of whatever the problem is, then sure, send them over. I have seen young girls for, injuries and stuff like that, but with what I usually tell them is if the pediatrician has hit the end of what they can manage, then please send them over.
And how long would a teenager see a pediatrician versus going to the GYN?
Well, it depends. There are some doctors who will see uh, their patients until they turn 21, some of them
Mhm.
19. So there could be some overlap while we're trying to transition them because they'll go off to college and then they'll come back to be seen and then they're in this limbo. So it just depends on what that particular pediatrician decides to do.
Gotcha. And as far as having a routine screening for women, what are some of the screenings that we should have routinely?
So pap smears are obviously what everyone, gets all bent up about because it starts at 21, but we will do them depending on your risk factor and what the test results show. There is a particular virus that we check for. It's called HPV, a human papillomavirus. That is one of the viruses that is essential in testing for because it's been known to cause cervical cancer or being associated with cervical cancer in addition to other risk factors. So we start testing for that, but not until 30. But we do a different kind of test. Cytology screening is what we call it, but we do that from 21 to 29. And then at 30, we start testing for the HPV virus.
Talking to Dr. Whitney West, and it is Wellness Wednesday at 94.1 WHRP. We're talking about routine screening for women. That said, how about the preventive screening for women? What can we do to stay ahead of any possibilities?
Well, excuse me, the pap smear is the screening test for cervical cancer. The breast exam that we do during that annual exam is part of that. So you can start doing that at 20-ish or so, a self breast exam, and we can teach you how to do that. There's handouts for that. I usually pass those out. But the mammogram, I usually do at 35, what we call a routine screening. We get that done. And if it's normal, then we don't do another one until you turn 40. And then at 40, then we start doing the mammograms every 1 to 2 years, depending on your risk factors. Now, if you have family history of breast cancer, depending on the age of the person who had the cancer, then that will determine when you get your first screening and then how aggressive we are with follow up.
So, to stay ahead of any possible medical health issues, you want to get your pap test, your mammogram. Is there anything else?
So they have dropped the age now for colonoscopies. It is now
Mm.
45. And again, depending on what your family history and risk factors are, it may need to be done earlier and more often. But they'll usually tell you if it's normal and you're healthy, that every 10 years. If they find anything, depending on what it is, it could be 3 years, 5 years, 7 years. It just depends on what's going on at that point. In addition to the colonoscopy, there are other things that your primary care doctor may want to do, like check for cholesterol, obviously follow your blood pressure, that kind of thing.
All right, let's stay healthy and get our routine checkups. Dr. Whitney West, what's the best way to get in contact with you?
My website is wsmdpc.com.
And your parting words?
Empower Wellness. It's a journey, not a destination.
Should I stop this recording, start another one, or we can keep recording for the second one?
It's easier to edit when you stop it.
Okay.
And let me put the date on this one. Got it. Okay. When is this one going to go?